The ACA, the Affordable Care Act, says that breastfeeding support services and supplies are a preventive service that should be covered in full with no copay, no deductible, no patient responsibility throughout the duration of breastfeeding. And that is a mandate, a national mandate. It is not happening.
Coverage isn't access, especially in postpartum care. And if you've ever been a new mom or supported one, you already know the chaos, the crying, the latch issues, the 2 a.m. Google spirals. The moment when it hits you, no one prepared me for this. I do not have any sort of a playbook. And no parent should have to battle their insurance just to feed their baby. Today, we're joined by Judith Nowlin, CEO of Nest Collaborative, who's made it her mission to change that. She has built the playbook for women, and she is creating real access to lactation care. She's building this for moms, for besties in postpartum, and for daughters still to come. This is what redefining women's health looks like. I'm Brenda Armstrong, and you're listening to Redefine Her. If you've ever had a baby or supported someone who has, you know that postpartum is not just a moment. It is a marathon. And somewhere between the grunting, the crying, the latch issues, and the tears, yes, yours and your baby's, most mothers are left with more questions than answers and absolutely no playbook. But here's the kicker. Even when new moms do reach out for help, especially with breastfeeding, their insurance may claim they have access to care while offering no trained lactation consultants at all. That's where today's guest steps in. I'm joined by Judith, the CEO of Nest Collaborative, a virtual lactation care platform that has delivered over 80,000 visits nationwide and partners with major payers to make clinical-grade breastfeeding support available to families right in their own homes. Judith is a femtech pioneer who bootstrapped one of the first pregnancy apps to acquisition. She's raised over $10 million in funding and has helped Nest double national breastfeeding success rates. And she's been in the room as a doula, an educator, a founder, and a mom. Judith, welcome to Redefine Her. I'm so glad you are here.
Hi, Brenda. Thank you so much for inviting me.
Yes, it's great to have you. Let's start with one of the key numbers that really stopped me in my tracks. Despite recommendations from the American Academy of Pediatrics and the World Health Organization, only 25% of infants are exclusively breastfed at 6 months. And it's even lower for Black families. And that's not because people don't want to breastfeed. It's because of systemic gaps, cultural biases, and lack of accessible support. Why do you think rates are so low, and what's not being talked about when it comes to access and support?
Breastfeeding is one of the most natural, organic, beginning of life, beginning of all time kind of activities a human can do. However, in today's culture and in today's society, we are removed from environments where breastfeeding is happening just the same as eating breakfast, lunch, or dinner. We're removed from environments where we're watching our own parents breastfeed, our aunties breastfeed, our neighbors, our friends, and we're isolated. So many of us as new mothers have moved far away from home. We're not living in the same house as our family members. We're not living down the block from our family members like my mom and her family used to do even a strong handful of decades ago. And so even though breastfeeding is really, really natural, without having observed it in a natural environment and having all of those experts in your home guide you through all of the tips and tricks and the challenges, we're left going, oh, I'm not exactly sure why this baby feels like it has octopus arms and I can't exactly get baby to latch exactly right. I'm not exactly sure what I'm supposed to be doing all throughout the night when baby seems to be incessantly crying. I'm not exactly sure what to do when I've got to go back to work after. In the United States today, some folks are going back to work after 2 weeks, 4 weeks, 2 months, or 4 months. So how do you manage all of that and all of the uncertainty that comes with that in today's day and age? And to be honest, a lot of people do not have the support that is required in order to just get those little tweaks, those little tips and tricks, and the knowledge around that's perfectly normal. That's what happens at this stage of the game versus, oh, that's outside of the realm of normal. And that's actually something that needs additional attention. And let's get you that attention and let's get it to you promptly.
That makes me think of one of the most Googled questions. Am I doing this right? And so you're right. We don't have that playbook and we're not seeing it. And we so often talk about we can't be what we can't see. So not having that, not having the eyes into what that looks like, we're facing postpartum and breastfeeding with a blank slate, quite literally. But there are tools out there. So tell me more about your journey and how you've come to be the CEO of Nest Collaborative.
We'll start way back at the beginning. Let's
Great.
rewind. We'll rewind 20 plus years. And I was a brand new mom. I have 3 kids and they're all young adults now. But 21 plus years ago, I had this newborn baby infant in my arms. And I was learning to breastfeed for the first time without any of that influence of having seen it or having anybody in close proximity. I was one of the first of my friends to have a baby. And so I'm trying to figure it out. And it's totally crazy. It's totally nuts. In fact, breastfeeding for me was actually more challenging than the labor and delivery itself.
Oh, really?
Yeah, it was, because my newborn baby, he wanted to eat every 2 hours around the clock for the first 4 months. And that meant that I wasn't getting any stretch of sleep. He was also a hungry little guy and he was gaining a ton of weight, and it was amazing and miraculous. And at the same time, in full transparency and full disclosure, I had flat nipples. And flat nipples were something that I did not know and I was not aware. I had no breastfeeding education or preparation. And I had no idea the road that was ahead of me with the process, the very natural process of the baby at breast drawing those nipples out so that the baby could effectively transfer milk that was like toe curling. And I just remember sitting there in my nursing chair and talking with friends and relatives and some other folks who did have babies at the same time as me. And for the most part, my labor and delivery experience was amazing and it was empowering. And I was telling my story about, wow, this was one of the coolest things I've ever done. So empowering. Like a baby came out of my body. I was in love with the process. And on the other end of the line, I'm getting feedback from those friends and relatives saying, this was the worst thing I've ever experienced. The labor and delivery, the immediate postpartum time, I feel all alone. I feel so isolated. No one is here for me. I was treated like a number at the hospital when I was having a baby. They didn't understand who I was or where I was coming from or what my needs were. In fact, my needs were ignored. And I didn't know how to advocate for myself, and my partner didn't know how to advocate. And it turned into an awful, awful mess. And at that, I thought to myself, man, what is the difference here? What's the difference? And the first thought that came to my head is we took an amazing childbirth education class. It was so good and so juicy and so thorough and talked about all the hard and ugly stuff. And we got into it. And I thought, man, if it's possible that preparation, that anticipatory guidance had anything to do with the positive outcome and the positive way I'm thinking about that entire experience, then I might as well become a childbirth educator and I might as well spread that wealth. And that's what I did. So became a childbirth educator, started teaching families. The families, you can probably have the picture in your head. They got their pillows under their arms and they're marching into my living room. And then we'd lay around on the floor and we do labor preparation and
draw pictures, visualize what you want your experience to be like.
All of that stuff. We did one exercise that lives in infamy. And when I see my old childbirth education students around town, they always bring it up. Actually, 20 years later, we did an exercise called the ice bucket. And we would fill a bucket of cold water and ice. First, we'd have Mom plunge her arms into that ice bucket. And then we would use all the techniques that we were learning in class about how to cope with that discomfort, both physical techniques and mental, emotional techniques. And we would then give the partner something very real to respond to. Okay, she's uncomfortable. What do I do? And then we'd talk about, okay, when partner came and did this and touched you like that or whispered this in your ear, was that helpful or was it not helpful? And so moms would be able to say, well, that part was helpful, but when you did this and you whispered that, like, not helpful, not funny. Please don't do that when I'm having a baby. And then the funnest part is when we would flip it and we'd get dad to get his arms in the ice bucket and for him to realize, okay, I'm doing 90 seconds or 2 minutes, kind of mimicking a contraction with my arms in the ice bucket. What is this actually like? And then we'd be able to really hit home and hammer home what she's going to be going through for her possible 5, 10, 20, 50 hours of labor and delivery with these contractions on board and moving powerfully through her body to assist in baby's descent and baby coming out. So we had a lot of fun in the childbirth education classes. So when we talk about the story, there's a lot more to it.
Oh, there's so much more to it. As a birth educator, did you cover lactation support at that time?
We did.
Okay.
Yeah. So as a childbirth educator, lactation support and breastfeeding 101 was a part of that prenatal preparation. But that's all it was breastfeeding 101.
So pretty basic.
Mm-hmm. Yeah. In childbirth education or childbirth preparation classes, I taught classes for about 10 years. And what I found over all time is that most parents were really, really activated around the preparation and the welcoming of baby. And then they almost forgot that there's a next part.
Oh, I can see that for sure. I think we're so focused on the moment and then the actual baby is here. And then it's like all of that training out the window because that's done. But then what happens next? And we're left somewhat isolated where it's like PTSD in a way. Everyone leaves us. The support is gone. We leave the hospital. And then here we are alone with a baby like yourself who wants to eat constantly. We're deprived of sleep because we are not fully functioning humans living off of sleep every 2 hours. Tell me more about your then journey from birth educator into creating iBirth, which was an early femtech company. And what have you learned from really building something super scrappy from nothing to really address these challenges women face?
From the days of childbirth education, I'm in it. I'm working daily with families in their preparation time. And we talk about the value of bringing all the specialties around. Where are your resources? Where can you find help for both preparation time, labor and delivery time, and postpartum time? And having ideas about where to go, who to tap, who to have conversations with about ahead of time is everything. And so we talk through birth doulas, postpartum doulas, lactation consultants, mental health specialists, meal preparation, dietitians if necessary, postpartum exercise, recovery, pelvic floor therapy, all of these supports that can come around and really create a lot more smooth transition through the postpartum time. And as I was teaching about these things, one family said, we'd like to hire a birth doula, and you're it. We want to hire you as our birth doula. And I said, well, I'm not a birth doula. And they said, yes, you are. And you're going to be ours.
Yeah.
And I went and I took the training. And it's true. Birth doulas it's a matter of the heart. And so you're training or no training, if your heart is in that condition to nurture and care for and attend and witness, you are a birth doula. And so I went and I took the training and I got certified and I started attending births with families at bedside, both in the hospital, birth center setting, and every now and again in a home birth setting. And as I'm going along, I'm starting to see something that was really, really interesting. As a birth doula, I was invited into every single hospital and birthing facility up and down the entire Front Range in the Denver, Boulder metro area where I live. And I got to see firsthand on one day, we're at this facility and the family is advocating and asking for something like using water therapy as a comfort measure for their labor time. And that hospital was, oh yeah, of course we offer that. Come on right over here. Here's the tub and here's how we're going to do it. And this is how we're going to monitor baby. And here are the questions you can be asking and let's do this. And then the next day I'm in a different facility, same exact scenario with the labor and delivery. And the answer is, we don't know what you're talking about. That's not a thing. That's not possible for you. That's not possible here. And mom would be sitting there going, but I'm looking at the tub. I'm staring at the tub right now. It's right there. Why are you telling me I can't get in it? And you're telling me I'm okay and I'm stable and baby's okay and baby's stable. And at that facility, they said, we'd prefer that you just lie down in the bed and just stay still as much as possible. And so I started taking notes.
Sure.
And I started going, wait a second, what's going on here? Why is there such a difference in education, in options, in what is acceptable or not acceptable? There is a clinical standard of care that is undebatable about what is safe or not safe. So why is it that we've got so much variance going on? And that's when I started to get some ideas. And I thought to myself, okay, this is interesting. It seems like there's space in the market to bring the type of education that we're doing, boots on the ground, and bring it to a wider audience. And so at that time, one of my families had said to me, Judith, you've been with us through our childbirth education. You've been with us through our labor and delivery. We want you to be our postpartum doula. We want you to come and help us transition into our home environment. And I said, oh, I'm not a postpartum doula. And they said, yes, you are, and you're going to be ours. And so I went and I took some training and I became a postpartum doula and I started helping families with that transition. And that's when the lights really started going off, where I was like, oh, wow. Oh, for all of the investment we all do in the preparatory phase before baby comes, literally there's almost zero investment in what happens afterwards and how to be prepared. There's change to be made in this space. And I'm going to go ahead and get after it.
From those combined experiences and being that witness, you saw what was seriously lacking in the system, in a system that really has not been built for women. And it was disparate. variances between different hospital systems, probably due to different policies, et cetera, all the things. But when did it click for you that technology could be a bridge between care and confusion?
Well, there was a season where I started to receive phone calls from across state lines. And families started to call me from Wyoming and Nebraska. And they started to say, Judith, I have heard about the incredible impact of your work. My old neighbor told me about it. My sister told me about it. You were their birth doula, whatever it was. And I would like to hire you. I'd like to pay you the money. I'd like to sign up for your class. I'm willing to drive 3.5 hours each direction, one time per week for 12 weeks to get to you. And I said, no, that's a bad idea because you're in your 3rd trimester. It's February. This is Colorado, and driving like from Wyoming, like this doesn't feel safe. I said, why are you calling? You have to tell me, why are you calling me? And they'd say, because we don't have what you offer where I'm from.
Mm.
And that's when it went ding, 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 ding. It just so happened to be 2008. It was the year of there's an app for that. The iPhone 1 was brand new. The App Store was brand new. There were all these commercials on TV that said, there's an app for that. There's an app for that. And I thought, there's an app for this too. Let's do it.
And so was born iBirth.
That's right.
Tell me more about that.
iBirth was born out of that, seeing the gap, seeing the need for people who were so desperate for that thorough, unbiased, holistic education so that they could be empowered and take control of their experience and navigate their experience in the way that they want to navigate it. However you want to navigate it, that's cool. Everybody's different. Everybody's looking for something different. Everybody's coming from a different background. But to be empowered with education, information, questions to ask, that was the basis. And I thought, if we can bundle this into an app, and we can get it distributed and into people's hands at a relatively low cost, and they can get it in an instant. Let's see what happens when we start building toward that. And then it took on a life of its own for the next 10 years.
This app was created, this solution probably expanded exponentially because of education unlocks everything. So opening doors, then girlfriends were telling their girlfriends and their best friends about it. And you just continue to grow. But then tell me about that transition and then how it led you to Nest Collaborative.
What I always tell entrepreneurs when they are asking, how exactly do I start something? How exactly do I build something? I don't know that I've got all the right tools at my disposal. I don't know that I've got all the right education behind me. I'm not trained in this. My answer is always, take what you do have. Take what you have and make what you can out of that. And align yourself with people, align yourself with advisors, people who've been there, done that, and take what's useful, toss out the rest, and keep putting one foot in front of another with what you have today. If you're waiting for all the stars to align, for everything to be perfectly in place and all the resources to be at your disposal,
you're always going to be waiting.
That's correct. For the rest of your life, you will wait because it will never be perfect. So if you can just start by taking and leveraging what you have today, what you know today. I mean, literally in those early days, it was like we were rubbing 2 dimes together to make this. It was actually a lot of dads who had taken my class or who had been my doula client who said, you being our doula, you being our childbirth educator, it changed our lives. And I'll help. How can I help? Oh, I code phones for a living. I build websites for a living. I do original scores and music. And it was like wild. And then they would come and say, how can I be a part of making your vision a reality? I'd say, okay, great. So the old joke with my co-founder and I became, I'm from Chicago originally. And the old joke became when my co-founder would say, well, now, how are we going to do that? We've never done this before. We don't really know how to do that. And then I'd say, I got a guy.
Yeah, exactly. It's funny because I was speaking to someone earlier today, in fact, and I was saying exactly that. It's like you've got to start somewhere, and starting with the tools that you have. The really beautiful thing when you are building something special is someone else has the tools you don't have. They have the experience you don't have, that you don't possess. And that knowledge share, that wisdom, those insights where other people have struggled and failed and succeeded, when all of that comes together with humility and graciousness and really that just pure desire and drive to create something special, magic happens.
That's exactly it.
Totally.
It's like magic. And I couldn't believe when we say, well, now neither of us are technical. We don't know how to code phones or code apps. We have no training in that. And then you just show up and be like, oh, hey, you're doing what? Yeah, I know how to do that. And I'd love to participate in this project because it's exciting to me. And your vision and your mission is so important. Let's spread this positivity. Let's see what we can do to create something that doesn't exist. So we went out of the gate as a direct-to-consumer app. And the apps were so new. There was no
Yes.
app economy. Nobody knew how this was going to work. Even at that time, there was no subscriptions. There was no automated, easy way to say, hey, here's your freemium and let's up-level you into your paid subscription. That's either you get to choose a yearly or a monthly. None of that infrastructure existed at all.
No, like the ideas weren't even out there at that time. And now we live our life
With
on
apps.
our apps. Yeah.
We do. Everything is an app. And all of the B2B enterprises, it was just very aspirational
Sure.
that there might be an app that the enterprise would leverage to meet their patient population, member population, customer base where they are. So we're so early. We developed the direct to consumer. We prove traction. We're just constantly iterating. We figure out what do the families like? What parts do they want more of? What parts are complicated and we need to create greater ease of use for them? And so we're just iterating and iterating and iterating. And they're, again, just listening and listening so carefully to our users and to our audience and those that we're here to serve. We started hearing the hospitals, health systems, birth centers, OBGYNs, midwives say, oh, this is amazing. And my patient absolutely needs this. But is there a way to kind of make it my own? And at that we said, yeah, of course there is. And we pivoted B2B.
Amazing.
Yeah.
So now you are infiltrating hospital systems and expanding even further. So gaining more traction. Then what happens?
Exactly. What was happening in the direct-to-consumer environment is certain consumers are saying, I think I need something like this. Or I heard my friend had a great experience with this. I'm going to go ahead and get it. So very word of mouth, very organic growth. And what happened when we pivoted B2B and we started creating a co-branded, customizable application that the health systems, hospitals, and large practice groups could use and talk to their patient populations from what's happening in their geography. What do they need their moms and dads to know about which door to walk in when it's time for labor and delivery, or what to expect when you come here for the hospital, or fill out these papers ahead of time, whatever it may be. all of that we start to integrate and build into our platform. And through this B2B model, now we're reaching patients and families who didn't have the idea originate within themselves that they need something like this.
Didn't even know to ask.
They didn't even know to ask.
Yes.
But now it's part of the care protocol that their OBGYN is saying, hey, part of how we care for you well is we want you to download our iBirth app, and everything you need to know is inside. It's going to be a daily care companion for you through all of pregnancy, from like day one, pre-day one of pregnancy through the first year postpartum. You're going to get tips and tricks, nutrition ideas. There were labor and delivery videos in there, what to expect, and ideas on how to comfort measures. A lot of the old doula tricks were inside. And now folks who didn't think to ask the question, how should I be prepared? What should I be thinking about? Are now, this is part of their care protocol and it's in their pocket.
Right. You've just totally scaled how many people you can impact through this experience. And again, everyone's journey is their own, but that education, that tool itself of being the support mechanism, when that expands and impacts more people, that increases our individual experience. It increases a hospital's patient experience when it comes to providing these services to families. And then it just eases so much of the burden of becoming a new parent, which is already so much work in itself. It's exhausting and you don't know where to ask. So you've given this playbook.
That's it. That's exactly it. The playbook. That's what it's about, because here's what most new parents really need to know. All kinds of weird stuff's happening. Like, whoa, where did this come from? This is so strange. I've never seen something like this before. And what all parents want to know is this within the range of normal? Because if it's within the range of normal, I'm good. Okay.
Fine.
Cool. Like, all right, whatever it may be. But is it outside of the range of normal? Do I need help? How urgent is it? And as brand new parents, we have no guidance on that except for the internal guidance, the guidance that
instinct
bubbles up from instinct, bubbles up from our gut and says, I'm actually thinking, as this child's mother, I'm thinking something's not right. And I'm reading all the books and I can't exactly get down to it. Or a lot of parents will report they went to 5 specialists and 5 specialists said, you're fine. Don't worry about it. It's nothing. But the instinct said, no, something's not right. And we need assistance here. And so much of that guidebook is about, how do you understand what's within the wide range of normal, clearly outside the wide range of normal? A lot of that is black and white. Some of these things are easy to just write down, like column A is you're good, column B is you're not good. But then there's the in-between.
The gray area.
The gray area. So a lot of what we did in the app, or in, what became this guide that's in your pocket, some referred to it as a pocket doula. So much of it was about, how do you navigate? How do you navigate those gray areas, those tricky situations, those moments when your gut is saying something's not right, but you've got an expert on the other side saying, don't worry about it. That's fine. And so empowering patients, empowering collaborative decision-making, that became actually my greatest pride and joy, and still is my greatest pride and joy. It's all about, how does a human figure out how to navigate their own circumstance, their own condition, and do so in a way that brings in the right experts at the right time, and that there is power in decision making, that the patient themselves or the human themselves at the end of the day goes, okay, I made that choice.
Yeah. And they have agency in it.
Yeah.
I love hearing that story because as women, so many times our opinion is discounted. So many times that instinct, that gut feeling of something not being quite right is pushed off to no, it's normal. It's just part of it. Whatever, carry on. You're fine. And often we know something is not quite right. So to have that resource and to have that, especially at such a pivotal time in and transformative time of life, having a child, it's key. It's critical. What do a digital psychiatrist, an AI health coach, and a public health game changer have in common? They're not sci-fi, they're real, and they're redefining care for women today. On Redefine Her, we sit down with the innovators behind Talkiatry, Wave, Joylux, and many more, founders who are flipping the script on women's health with heart, grit, and bold ideas. If you're into big conversations and even bigger missions, hit like, subscribe, and leave a review. Even if it's a love letter or a strongly worded rant, seriously, we read them all. Find Redefine Her wherever you get your podcasts and come help us rebuild this industry from the inside out. Thanks for listening. Let's keep redefining her. So iBirth grew and it was purchased by Baby Scripts in 2018.
That's correct.
So now I imagine they are also expanding that, leveraging more AI and machine learning and utilizing technology to create better precision care and a better user experience. Are you still in touch with them? What is the next part of your journey?
I was on a call earlier today with Anish, who is the CEO of Baby Scripts.
Amazing. So shout out to Baby Scripts.
Yeah, it is amazing. And we were on a call because our businesses now are tangential. They ebb and flow together. So Baby Scripts really in 2018 at the time was the leader in the remote patient monitoring for pregnancy and postpartum space. They were the leading platform. So they've got this clinical angle where we're watching clinical data points flow through the platform and send flags up and alerts to both patient and provider to say, hey, oh, your blood pressure is looking like it needs attention. Let's get to that right away rather than wasting any minutes, hours, or days. And it's a transformational technology. So at the time, they are doing remote patient monitoring and that super heavy clinical integration. And iBirth was the patient journey side. So that day-to-day care companion. And when they approached me, they said, look, you've got the care companion patient journey side. We've got the clinical remote patient monitoring side. If we come together, we're best in class. And I was like, you know what? That's right. We are best in class when we come together.
We are better together. And so when you see a solution like that, it helps you remove a lot of those single point solutions and it allows a holistic approach to care.
That's right. That's right. So I was with Baby Scripts. They acquired the company and I was with Baby Scripts for a few years after the acquisition as chief growth officer. I got to continue working with incredible enterprise clients, make sure that the integration of iBirth into Baby Scripts went smoothly and the iBirth product still lives on. So at Nest Collaborative, we work with health systems, hospitals, large practice groups, and I get to actually work with a lot of customers who are using Baby Scripts.
So it's like coming full circle for you.
Full circle. And so when they talk about it and they brag about it and they talk about the care companion aspect, I'm like,
I know.
My baby.
I know.
That's my
Thank
baby.
you.
And I feel like I've got 3 kids of my own. And I thought of the idea for iBirth when I was pregnant with my 3rd baby. At that time, I had 3 kids, age 4 and under, and was starting this healthcare technology company. And it felt like my 4th baby. And then with the acquisition of Baby Scripts, then that felt like sending my baby off to college. And so now I get to see my baby doing well in the world world and being loved on by so many. And it brings me such joy and satisfaction. It's an amazing journey. And so after my role of Chief Growth Officer at Baby Scripts, doing a lot of the business development stuff, then I started working as an advisor to female-founded health tech companies. And I got to do that advisory, consulting role, take a lot of those lessons learned building from 0 to 1 and help founders navigate those early days.
And those early days are long days filled with lots of questions, lots of uncertainty, lots of true hustle, but from a place of heart, because these founders, they've got solutions that they want to get into the world to these problems that we all have experienced at some point in our life. So then, as you are offering this guidance and being a mentor to these amazing women who are starting health companies, health tech companies, what then happens to you? How do you land into this role with Nest Collaborative?
It is so amazing, the entrepreneurial journey and how it unfolds. And it unfolds and rolls like a rushing river. And there are so many sights to see and interesting parts along the journey. And I'm advising companies and I'm realizing there's a part of me that's like, man, I miss team. I miss team.
I hear that.
Yeah. It's a very luxurious part of building. And I say luxurious because there is luxury in not being alone. And so for a lot of founders, they're really, really alone as they're building from 0 to 1 and they're bringing their vision to life, bringing their baby to life, the thing they care about and the problem they want to solve more than anything. And we do well when we've got the right team around us. So one of the companies that I had the privilege of being an advisor for, this was the year 2021, mid depths of the pandemic times. Telehealth goes from some obscure concept that is on the fringe of the healthcare system to center stage.
Totally bonkers. Yeah.
Fast. And it
Overnight,
happened
practically.
fast. And so with Nest Collaborative, the board were looking for someone who had that business prowess, that operational ability to scale fast, build systems, build process. And that's my specialty. That's what I love doing the most. And so it was just such an obvious fit.
Yes.
For that next step in my career journey, especially around my passion around breastfeeding. And if we rewind all the way back 20 years, that recognition that the postpartum time after baby is newly in arms, after everyone's discharged from the hospital, and we're now settling in at home, that time is where we have the biggest gaps in our maternity care system in the United States today.
We have a lot of gaps in the system of healthcare today. If we are talking specifically about Nest, it clearly isn't trying to be everything. It's not solving everything along this journey. You guys are specializing in lactation care. This is a great alignment. It's a great next step in your career process. But what is the laser focused initiative of Nest Collaborative and the specialized platform in terms of how are you thinking of that in the bigger movement of postpartum innovation?
At Nest Collaborative, we are reimagining expert breastfeeding support through the power of telehealth. It's virtual first, reimbursed, reliable, and ready when families need it most. And through that, we create lifelong impact for generations to come. Now, the key here is when I vision the world as it needs to be related to postpartum care and how we care for our mothers in the United States, it's seamless. It's smooth.
We don't need more friction through this
No more
experience.
friction. We got a lot of friction already. No more friction. We need a well-crafted experience that meets the patient, the insurance plan member, the employee, the new mother. We need a system that meets us where we're at and doesn't send us on a wild goose chase, because that is the current situation. Is here's some cards, go call them. Here's a list of people who might be able to attend to your needs, maybe, if they're still in business, if they're still around, if they have appointments available sometime within the next 3 months, if they take your insurance, I don't know, go call them and find out. I'm sorry, as a new mother, I'm working really hard to brush my teeth every day, let alone figure all that out. That's what we're here to do as Nest Collaborative. It's so much bigger than lactation support alone. Lactation support is the perfect time to have a moment of impact and a moment of meeting with a new mother-to-be or a new postpartum mother. Because here's the deal. Whether or not you want to breastfeed, you don't have to breastfeed. You can do other ways. That is perfectly fine. But the truth is whether or not you want to breastfeed as a new mother, you will lactate.
Right.
And so guidance, putting together a plan, understanding how we're going to manage this, understanding what happens next, and considering why is it that maybe I've decided I don't want to breastfeed? Is it because I've never seen somebody successfully breastfeed? It didn't work for them, so it's not going to work for me. Is it because the management of breastfeeding seemed like way too much of an investment for my life and what I've got going on with my work and my home life and my situation at my community, whatever it is? And so it's starting to explore what is that? And is it worth possibly getting some amount of expert education and anticipatory guidance, talking about a plan, talking about how to navigate, and giving it a try, at least giving it a try, and see how it goes and see what you think.
That lactation care supports maternal mental health as well. And so maybe someone is feeling either the stigma around it, that they shouldn't do it, or because they're unable or not supported because they haven't seen it from someone else in terms of their family history. Then we put all of this on ourselves. So already we're in this majorly transformative period of our lives. And then all of these questions are coming in and all of these thoughts around, well, am I a good mom because I can or can't breastfeed? So mental health is a big component of it. And that having that support has got to lead to better mental health outcomes for women as well through this journey. Not only at the beginning, but like throughout their postpartum experience and beyond.
It does. It does, because having agency, and I'm going to decide. Something didn't just happen to me. Instead, I'm going to decide. This is what I want to try, what I don't want to try. This is how I want to do it, how I don't want to do it. This is who I want involved, who I don't want involved. Agency around the steps that we take, that creates more peace, more peace of mind as we navigate, and having an advocate. Sometimes people can think that IBCLCs are breastfeeding no matter what.
Right.
And that is absolutely not the case. Absolutely not the case. They are clinicians who are the gold standard in clinical lactation support. So they have had training that is unlike any other practitioner out there in the medical science of lactation and how it works, how to solve problems, what to look out for, how the mental health is all tied in. And under no circumstances are IBCLCs sitting in a position of breastfeeding at all costs. They are in a position to help parents navigate their lactation journey. And for some, that includes breastfeeding for the American Academy of Pediatrics recommendation and beyond. And other times it includes successful, harmonious, kind, compassionate, loving weaning earlier than what the American Academy of Pediatrics recommends.
Sure. And I imagine it also may be, understandably, this isn't for everyone. So let's support your transition and your mental health around the distress that this is causing you as well.
That's right. That's right. So in our visits, this is the coolest part. There's so many cool parts about what we do. I won't undermine it. There's a lot of cool parts, but one of the coolest parts is that we are looking at the breastfeeding parent holistically. Holistically. This is not just about breasts and milk and baby's mouth and baby's tongue position. This is about the whole person who's sitting on the other side of the screen during the telehealth appointment. And we meet parents right where they're at. And so in addition, of course, to the expert lactation care, the IBCLC knowledge around clinical lactation, we're also doing maternal mental health screenings for anxiety and
Amazing.
depression. We're
Yes,
doing intimate
brilliant.
partner violence screenings because there are so many families who don't know where to turn when things feel unsafe. And so we are meeting families in the comfort of their home, unlike a doctor's office where maybe you're sitting in the room with a doctor for 3 or 5 minutes
Right.
and you're feeling nervous and you got to get through everything real fast. There's not exactly that time to open up and say, I'm actually feeling unsafe in my home or in my living situation or with my spousal partner or whatever it may be. So we do those screenings. We get to have that moment of intimacy. Our appointments are much more lengthy than what we're all accustomed to when we race in and out of a doctor's office. We get to spend legitimate time with families understanding who is the whole person that we're talking to right now and what are the considerations for the whole person as it relates to breastfeeding, the breastfeeding plan and or a weaning plan.
I absolutely love that. That is full service, wraparound services to support a mother's experience, a breastfeeding parent's experience through this journey. One key thing that does come to mind for me is the financial side of it. We're all obviously paying attention. Everything is getting more expensive these days. And from what I understand, commercial plans really are not covering lactation visits in the way that they should be or could be. And I see this with a lot of women's health services overall. They are not treated necessarily like primary care and probably should be. On top of that, 75% of people don't even understand what their insurance actually covers at all. So, how are you guys addressing this component, and how is that allowing you to build trust, and this component being that payer reimbursement and, the financial component of having a child and paying for lactation services? And how do you build trust with your patients to overcome that burden and continue to create this seamless service, a holistic, seamless service?
Accessibility is our mission. How do you get the right support to the right person at the right time, and not just for the lucky few? How do you get it to the population at large? How do you serve all the people who are deserving of this support? That's the question that we're here to answer every single day. And we work so hard to get to the bottom of that question, and it's a complex one. So I'm very proud to say that almost 4 years that I've been in this role as CEO at Nest Collaborative, we can now accept over 300 insurance plans across the nation. And we're enrolled with Medicaid in 8 states. And we're growing that. The mission is to make this care easy to get to. And part of that is the telehealth platform that we've designed. So you can wake up in the morning and go, I think something's up. I think I might need help today. And by the way, when it comes to a hungry infant, I need help today does not mean let's see if I can get an appointment in 8 hours, 8 days, or 8 weeks, which is how the health system works. So I need help like now. Baby was up all night crying. I'm in pain. It seems like something's really, really wrong. And I don't have much time to solve this problem. So the telehealth platform that we've built gets people into appointments as quickly as 2 hours from when they realize they need one. That's like a 180 from the status quo. The status quo was, let me go find that piece of paper they gave me at the hospital with all those people's names on it. Let me see if I can find it. Now I'm going to call the first one, find out, oh, she's 2 hours away. Let's call the second one. Oh, she's nearby, but she doesn't have an appointment for 2 more weeks from now. Let's call the third one. Oh, great. She's nearby and she has an appointment later this afternoon, but she doesn't take my insurance. And so
Right.
all of a sudden it's a no. And it's I guess I'll just figure this out on my own. I don't know where else to go.
Right. And that's not care.
It's not care. No, it's abandonment.
Totally. More isolation.
It's more isolation, and it compounds the problem that we're having in our maternity care system today. And it compounds the problem of the awful statistics that we have when it comes to the way that we care for our new mothers and babies in this nation. And so we've developed a platform where you find Nest Collaborative, you put your insurance information in, you put your medical background and history in, you fill out a form, sign here, and you can be into an appointment same day. And if not same day, next day. And if you want to do the preventive care appointments, like, you know what, I'm returning to work at 8 weeks. We're going to talk with you about what does it look like to get the appointment at the right time so that you can begin preparing for your return to work. Because return to work isn't just something you do one thing all the way up and then next day you show up at work and then all the breastfeeding and milk storage and pumping and all the things work smoothly. No. We've got to prepare for it, and we've got to start a freezer stash. We've got to get baby familiar with the bottle, and there's a lot of different elements. So then we do the preparatory guidance. So the platform and operationalizing this platform to make it really, really seamless is part of what makes Nest Collaborative so unique and helps solve this accessibility problem. And of course, because it's telehealth, geography is not a concern. You can be in the middle of nowhere. You can be one of those folks who was calling me 20 years ago from Wyoming or Nebraska who says, I don't have access to this service where I'm from and I need it. Boom. You can be in with one of our IBCLCs and get the care you need in the right amount of time. Now, the next part of that equation is the insurance reimbursement.
Yeah.
So that is a really big topic. The ACA, the Affordable Care Act, says that breastfeeding support services and supplies are a preventive service that should be covered in full with no copay, no deductible, no patient responsibility throughout the duration of breastfeeding. And that is a mandate, a
And is it
national
happening?
mandate. No,
Yeah.
it is not happening. And I spend probably 90% of my time in this role working really, really hard to crack that riddle, if I'm putting it nicely.
Oh, yeah, it's a mess.
It's a mess. The other part of the mandate says if the insurance plan does not have an adequate network, they must reimburse these services as preventive services out of network. So there's a few keys to unpack here that are so critical. If any of the listeners want to look up, you can just very simply Google Mississippi lactation coverage. They're going to find some articles where one of the large payer plans says, look, we've got an adequate network. We've got this coverage. But when we unpack it, here's the coverage. And you'll hear the patient testimonials, you'll hear the IBCLC testimonials, and some of the provider testimonials.
Yeah, so that on paper, that plan might say that they have postpartum care. But when families need lactation consultants, they don't have that. They don't. It's like OB care. That's it.
They do not have an adequate network of lactation support services. So what some of the plans do is they say, look, lactation coverage is absolutely covered in the bundled payment that we pay to OBs for the labor and delivery, the prenatal labor and delivery and early postpartum care. But here's the thing. Once mom is discharged from the hospital, there's no more lactation support services stood up for her. There's nowhere for her to go. It is not the OB's business to be providing lactation care, nor is the OB expertly trained in lactation care.
Right. Plus, they're like on their way to deliver more babies. Like
That's correct.
Next.
Yeah.
And of course, they have the best intentions in mind, but that's not their lane.
It's not, nor is it the pediatrician's lane. The pediatrician is a baby doctor, and the pediatrician is also not expertly trained in lactation support. And so when a health plan says, we've got an adequate network, it's the MDs who are the ones who are responsible for delivering lactation support, and they get it. Families get lactation support in the hospital stay. Well, these days, a lot of families are discharged at 24, 48, or 72 hours. That's way before most of the lactation concerns and problems begin to surface once we're back at home with baby.
Right. Plus, you're like dealing with all the things of the hospital. Like, it's so complex. And the continuity of care within the current model is not working. We have this major gap. So how are you guys solving this payer reimbursement? Because that could definitely be a game changer.
It will be a game changer. It is a game changer. Let me tell you the aspirational view of the future, I imagine. It is so simple. It is so simple. So while the ACA says that, what's actually happening behind the scenes of insurance reimbursement for lactation care is a lot of payers not covering lactation services beyond what they say the OB's covering during the hospital stay, not acknowledging, recognizing, or credentialing IBCLCs as the gold standard and the appropriate care provider for expert clinical lactation care. They don't credential them. They don't recognize them.
Like shocking.
It's so simple. It's shocking. And then when it comes to coding and claims, no universally recognized code for how this service should be reimbursed, which means that for 300 different payer plans that we accept, there are 300 different ways they expect us to submit the claim because they say, oh, we don't recognize that code, that's so on and so forth. And then the claims get denied. Here's the real trick. We've seen the patient, delivered the service to the patient. We have, of course, paid our IBCLC and our professional staff.
Right.
And then they opt not to reimburse. And so it creates a really, really challenging environment in which to bring forward services that are not only deserved by the patient population,
Basic human rights and required
by law. And so we work behind the scenes to smooth that path out. And it is a lot of heavy lifting. We do accept 300 different plans, which means we've cracked the code. We've figured it out with a lot of the insurance companies.
Yeah.
But there are some who, even though we have a contract, even though we have agreed to provide care to their members, they will not pay, or they will not pay the requisite amount, or they will deny, and put you through the loops, like infinity loops of reprocessing and trying to get paid like just the basic amount. So this is what I imagine. In a perfect world, all of our payers say, we recognize IBCLCs, just like a dermatologist, just like a dietitian, just like any other specialty that is recognized as the gold standard of care for that particular condition. Our payers, and I'm talking all of them, this is my wish, they'd say, we recognize IBCLCs. They're the right ones to deliver this care. That's one.
And here's the CPT code that we are going to pay.
And here's the code, and here's how it works, and here's how it's priced.
Done.
It's done. It's as simple as that. It is as simple as that. But the archaic systems by which the payers function and how they slow to change and slow to bring forward edits and adjustments to how they've done things forever, we're stuck in a business model that is downright harmful to the patient population at large. Moms and babies are suffering all around the nation because their plan has decided that they don't know what an IBCLC is and they can't credential an IBCLC, or the OBGYN covering lactation care prior to the time of discharge from the hospital is more than enough to meet the requirement of the ACA mandate that says these services should be covered through the duration of breastfeeding. And so my ask of all families out there is, if you, even for a second, think, why am I having such a hard time getting access to the care that I rightly deserve and that is mandated for me to get? You've got to speak up and approach your payer plan.
You have to. When we're looking at current cuts that are happening, and 40% or more of babies born are born under Medicaid provisions. Of course, every state calls it something different, but that's a lot of babies. That is a lot of babies being born under Medicaid, which is really facing some upcoming challenges. Do you have any thoughts around what is going on with the current administration, how we can solve this for people to have agency and not give up? Collectively, we have to also create the space to allow people to stand up. And so what does that look like? From Nest Collaborative's perspective, how can we support this continuity of care and not breaking these systems that are so needed as basic human services?
It takes all of us. So everybody's working from a different angle. And I always love to assume positive intent and good faith. And those who are working diligently and passionately to truly solve the healthcare crisis that we're in as it relates to maternity care, it takes all of us. And what's most important is the patient is part of that equation. So I spoke about some plans that have caused more harm and damage to the profession, to our company, to their members that they're here to serve. That's one side of the equation. There are other plans who are on the opposite side of that equation and understand their role in creating equity and access and how important preventive care is to what the future looks like for the patient populations, their members, these newborn babies coming in and joining us here on planet Earth. Like, there are plans who are doing the right thing, and they are nimble. They're able to change. They're able to adjust their protocols. They're able to say, oh, you're right. That doesn't make any sense that we wouldn't credential an IBCLC. Let's go ahead and credential IBCLCs and we'll get this care to our members like they deserve. And it's brilliant. But the most important part of all of this is for the members or the patients themselves when they're sitting in a place of frustration. I'm so confused. Why is this happening? Why can't I find care? Why do I feel like they're sending me on a wild goose chase? Why are they making me pay out of pocket? Why am I paying? This is supposed to be covered.
Right.
You've got to pick up the phone and call. You've got to write the email and send it in and say, hey, my plan, I have been forced to pay out of pocket for this service. And I looked around for a provider that was in network, and there are none. Or the closest provider is 2 hours away. And I've got 2 other toddlers here, and my breastfeeding situation actually needs attention today or tomorrow, not in 2 weeks when that provider is available. As patients, we have to stand up and say what needs to be said and ask the plan and demand from the plan that they fulfill their commitment. We're paying the premiums. They need to fulfill their side of the commitment in this equation so that we all elevate to better health and wellness, physically, mentally, emotionally.
I love that you are on a mission to really build systems that reduce chaos, not create more of it. Because again, it does take all of us, and it does take the patient, the mother, the breastfeeding parent to come to the table with receipts, because you've got to document this journey. That's the only way that we are going to impact change. As you mentioned, plans are changing And we have the opportunity to leverage technology to make that impact. And we have to iterate. We have to change. We've been having babies forever. We've been nursing our children forever. But these solutions have to come up to speed. We can't keep having chaos around these basic human rights.
That's right. I've lived it for the past 20 years from the business perspective, also from the mother perspective. And what I know to be true is that it is cruel and unusual punishment to put a new mother in a position where she's got to jump through more hoops, navigate more paperwork, find her way through uncertainty and confusion in order to get the basics. It's not right. And there comes a point where the madness has to stop and we have to prioritize. We have to prioritize the basics. It is not rocket science here. It's not.
That's right. Unfortunately, it leads to people just giving up.
That is exactly what it leads to.
Yeah, and that's not helping anyone.
Breastfeeding doesn't always go according to plan, and that's okay. Whether you're navigating your first days of nursing, dealing with supply concerns, or just need someone to listen and help you problem solve, you don't have to figure it out alone. Nest Collaborative connects you with board-certified lactation consultants who get it. Real experts, real support, right from your home. Virtual appointments that work with your schedule 365 days a year, covered by most insurance plans. And Nest's diverse team of IBCLCs speak your language, literally and figuratively. Because every family deserves personalized, compassionate care, no matter how you choose to feed your baby. Nest Collaborative. Visit nestcollaborative.com to schedule your appointment today. Supporting you through every step of your feeding journey.
You've been doing this for 20 years, and you are still incredibly passionate about creating solutions to a woman's journey of becoming a mother, becoming a breastfeeding mother with Nest Collaborative. How do you stay in alignment while wearing so many hats? A CEO, a mother, an entrepreneur, gosh, you name it. How do you stay in alignment and not face that burnout? Because this could create some burnout when you keep fighting these battles that are uphill battles with the boulders rolling downhill at you every single minute.
Perfect description. That is what many days feel like. You captured that really well, Brenda. Thank you. Thank you for seeing me.
I can't even imagine because it's so complex. It should be simple, but it is not.
It is so complex. And the boulders are every day there's a new one. And as soon as you recognize the boulder, you identify it, you kind of assess it, you understand the dynamics of what's coming at you, and you know what to do with it. You've got a plan and you deal with that boulder coming at you.
There's another one.
Wake up tomorrow, here comes another one. And it's brand new and you got to run through that whole process again. So in women's health, honestly, that is what it has felt like. Being an entrepreneur in women's health for the past 20 years. And as far as my self-care, self-attention to make sure that I can stay the course, it has everything to do with understanding what brings energy back to me. So how do I seed energy back in? Because all day long, there's a lot of energy going out and a lot of problem solving. And it's so complex that if I didn't take time to, number one, recognize what seeds energy back in, and then two, actually do the thing that seeds energy back in, then the burnout would have been present a really long time ago and I would not still be on this mission. So those specific things for me is my superpower is sleep.
Yes.
I love sleep so much. Sleep is the center and the core of it all.
Moms out there, take that advice. Sleep when the baby sleeps.
That's right. That's it. That is it. And it's so true. Sleep when the baby sleeps. Take that nap with your toddler. Treat yourself well and leave things if you've got to leave things, but tuck yourself into bed when it's time to tuck yourself into bed. Luxuriate. If there's one day where you can buy yourself the opportunity to luxuriate in the morning and not have to jump out of bed because someone else can be responsible. No matter who that is, try to figure that out. And so throughout this whole journey, starting with the 3 kids age 4 and under while I'm birthing a company, and then all the way to this day, sleep is my number one and I hold it sacred. I hold it really sacred. I don't let anything get in the way of it. Everybody knows that I go to bed really early, like really early. And I've got my sleep routines that feel really nourishing, that if my mind's racing or my heart's racing, I can turn on my sleep story, do my activities that I know work for me.
Yeah.
And sleep is the foundation. And from there, then I've got more routines that I hold sacred. So there's a morning routine with my coffee. My brain is in a different state when you first wake up.
Yeah.
And so I hold that time sacred to actually do a lot of my creative work. So if I need to write something, if I need to work creatively on a project or a proposal, or even solve one of our big problems or a big payer problem, I'll set that time aside, just me, my coffee, and my readers. And and I dig into it, and I dig into it for 60 or 90 minutes and then have the opportunity to walk away and go, okay, now what was that bubbled up during that time? And often there's a lot of unlocks that are really inspirational during that morning coffee time where I go, oh my gosh, wow, there it was. That solved something. Now let's go ahead and put that into action this week or as part of this quarter's plan, whatever it may be.
Yeah. And that even includes, I need some downtime. So I'm going to schedule a vacation, or I'm going to take that opportunity to luxuriate, not focused on work, because we have to find the constant inspiration and continuously come back to that which we are aligned to. But that does require self-care and attention and breaks. And for new parents, same. You cannot give your best all the time without creating some systems and routines for yourself that give you that nourishment back.
That's exactly it. And whatever that may be, it looks different for everybody. And the amount of time that you have to spend looks different for everybody. It can be something as simple as giving yourself the privilege of, when you're brushing your teeth in the morning, looking at yourself in your eyes and saying, I love you. I'm proud of you, girl. You are doing this. Maybe a little messy, but you're doing this. You got this.
Keep going.
Keep going. And I love you. I love you for the way that you navigated yesterday. I love you for the way that you are looking forward to what's going to be different or good today. I love you for giving yourself a second chance to try something else because that didn't work, whatever it is. So that's during the brushing of your teeth time. What is that? A couple minutes? You can do that. You can do that. And I remember even doing it when the kids were little, but now it's a lot less chaotic and a lot more rhythmic and predictable. I go for a joy jog every morning.
Yeah.
And my daughter is a D1 college athlete in track and field, and she is my inspiration. And I think of her every time I'm running, but I certainly don't look like her when I'm running. Instead, I'm joyfully jogging along and with a big smile on my face and trying to really get that hormone rush, that positive endorphin rush to flood my brain and to get me ready for the day. And so I might go slow and I might do some fist pumps as I'm listening to my music and going along and cheering myself along for, okay, today's going to be a day, but let's do this.
Totally. My morning meditation manifestation is 3 H's: healthy, happy, and helpful.
Ooh.
And how can I be that today? What can I do to make sure I am living with that top of mind? Doesn't always work. It's sometimes messy, but it's part of my morning routine.
But just having something to anchor into.
Yes.
Something to anchor into where you go, okay, here's my intention. It's about to go a dozen different ways, perhaps, but this is my intention. This is my true north. This is how I'm going to align myself around what comes into my presence today.
Yes. Guideposts, guide rails, North Star. Love that. You are also your daughter's inspiration. She may not share it enough with you, but I can guarantee you have been an inspiration through this conversation. So I just have to imagine that all 3 of your kids think that you are a superhuman.
Well, thank you. And in fact, I don't prefer gifts much from them. So what they've learned to do over time is actually write notes.
Yes.
And those notes are the greatest gift that my heart could ever receive. And I actually have them posted right next to my desk. And actually that's what those notes say.
'Cause you are. It's true.
Thank you.
Most definitely. Judith, it's been great to speak with you. I have one last question from our last guest. We like to pass the mic forward. What is one thing that you wish every leader, every entrepreneur out there knew about solving challenges in the great blue ocean of women's health?
It's a new frontier. Even though women's health is central and core to all life, all humanity from the beginning of time, those who are entrepreneuring right now in this day and age in women's health, we are just on the brink, just now on the brink of entering into a time and a space where women's health is getting the attention that it deserves. It's getting its moment on the stage. It is being heard. For the first time in my lifetime, and I know in my mother's lifetime and my grandmother's lifetime, this is a new frontier, and therefore we're frontiers people. You know, I often put an image in front of my team. It's like it's a deep wooded forest and we are just macheting our way through that forest and finding the way and finding the path and not just finding it, but we are paving it. We are establishing the path. That's what we're doing right now. But it often feels like you're wandering around going, shouldn't there already be a path laid out for this? And while you might think so, in women's health, there hasn't been to date. It takes all of us to make the change that we're looking for when it comes to women's health. So that is enterprise organizations, payer organizations, startups like Nest Collaborative, and families themselves.
Yes.
The mothers, their partners, to participate in this change that we imagine, where we are smoothing it out. We're smoothing out the chaos, not just for ourselves, but for our sisters and our daughters to come.
Be the change you want to see.
That's it.
Love it. Beautiful.
Okay.
It gives the meaning of frontier woman a whole new meaning, doesn't it? Yes. And here we are. It's amazing. There is so much opportunity. So I agree with you. Keep going. grab your bestie, grab the other women in your life and your toolbox, and don't forget the machete. Let's chop this forest down and make it happen for women everywhere.
Let's do it.
Let's do it. And how can people find Nest Collaborative?
Folks who are interested in learning more about Nest Collaborative can visit us at www.nestcollaborative.com. It is so easy to book an appointment. I am not joking. You hit the website, you say, book an appointment now, you fill out those questions and that paperwork, and most folks can be in same day. Others, if you're just prenatal and you want to get some of that prenatal education, coming to see an IBCLC for prenatal preparation is so valuable. Not only is a what to expect 101 covered, but also full medical history. That is so important. Has there been breast augmentation? Are there flat or inverted nipples? Is there a history of trauma in any way? All of these factors should absolutely be considered in the plan. Once you have baby in arms, how you want to approach the idea of breastfeeding and what it's going to actually look like for that first day, that first week, those first months, and for some who continue breastfeeding into the first year and beyond.
Amazing. So nestcollaborative.com is where new parents and those on their prenatal journey can go to find out more.
That's it. Find us at
Awesome.
nestcollaborative.com.
Awesome, Judith. Well, thank you for joining us on Redefine Her today. I appreciate you and the work you have done and are doing.
Thank you, Brenda. What a pleasure.
Totally. This was awesome. We often think of innovation in women's health as shiny tech, new diagnostics, or bold predictions about the future. But Judith reminded us today that sometimes the most powerful change starts with simply making care accessible. Lactation support isn't a luxury, it's a lifeline, and every parent should have access to that without having to jump through hoops. Our babies deserve it. If today's conversation moved you, share it with someone who is navigating postpartum, someone working in health policy, or someone building in femtech. And remember, when we remove barriers for one mom, we make the system better for everyone. Thank you for listening. Thank you for being you. And thank you for redefining what is possible in the world of healthcare. You can learn more about Nest Collaborative at nestcollaborative.com, and we've linked resources in the show notes, including Postpartum Support International. I'm Brenda Armstrong, and this is Redefine Her. Thanks for listening, and thanks to everyone who is redefining what is possible when it comes to women's health. Redefine Her is hosted by Brenda Armstrong and co-produced by Brenda Armstrong and Taryn Long, with community support from Ineska Viljoen. We're three women walking our own paths through endometriosis, PCOS, and perimenopause, and we created this show because we know how isolating, confusing, and overlooked these journeys can feel. Redefine Her is our way of changing that. We're amplifying the voices of women transforming health and wellness for women from the inside out. Thank you for listening, for sharing, and for being part of this movement. Be sure to subscribe, follow, and stick with us because Redefine Her is just getting started.